Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
The journey to getting a diagnosis, especially for something complex, can just feel like years of, frustration, can it? Little symptoms, vague clues.
Absolutely. And with conditions like multiple sclerosis or MS, we've known there's this sort of lead-up time, the prodromal phase.
Right, a few years maybe before things become clear.
Exactly. But what if?
Yeah.
What if that phase isn't just a few years? What if it's actually decades long?
Decades? That sounds pretty radical.
It is. And that's the really startling idea coming out of some groundbreaking new research. It was published in JAMA Network Open.
Okay.
And it basically shifts our whole perspective, suggesting maybe diseases like MS start way, way earlier than we ever thought.
Wow. Okay, so that's what we're diving into today then. This study sounds like it found these really subtle patterns in how people use healthcare.
Yeah, patterns showing up maybe 15 years before the first clear MS symptoms.
15 years.
It's not just about, the medical condition itself. It's about rethinking how diseases progress and what that could mean for maybe catching things earlier.
So our mission today is to really unpack this study. What did they find? What does it actually mean?
Exactly. We'll dig into the details, the surprising findings, the implications, and also touch on what neurologists are saying, what you can actually do with this knowledge.
Great. It's all about getting you properly informed. So let's set the stage. What was the big question they were trying to answer here?
Well, like we said, most research on this pre-MS phase, the prodrome, looked at maybe 5 to 10 years before the first demyelinating event. That's the nerve damage, right?
A hallmark of MS.
But this study asks, okay, what if we look way further back and specifically look at healthcare use before doctors even suspected MS, before the first symptom was noted?
Not just before the diagnosis code, but before the actual experience of a symptom.
Precisely. Going back to those potentially subtle things that didn't immediately scream MS.
So how did they even approach that? How do you study something so far back?
They used a really smart study design, a matched cohort study. They got access to healthcare data collected over, almost 3 decades.
3 decades?
Yeah, from January 1991 to September 2018, using the Universal Health Insurance System data from British Columbia in Canada. Massive data set.
Okay, that's a huge resource. And who are they looking at specifically within that data?
So they identified just over 2,000 patients, 2038 to be exact, who eventually got diagnosed with MS via official clinic records.
Okay.
And then, this is key, they matched each of those MS patients with up to 5 people from the general population who didn't have MS.
And the matching was quite detailed, I gather.
Oh, incredibly detailed. Matched by sex, exact birth year, socioeconomic status, even down to their postal code.
Wow. So they were really trying to isolate patterns specific to the MS group.
Exactly. Controlling for all those other factors that might influence why someone sees a doctor.
Yeah.
Comparing apples to apples, essentially.
And how did they track the actual healthcare use over such a long time?
They use linked records, clinical notes, administrative health data. So that includes every doctor visit, hospital trip, the diagnoses given, even the type of specialist seen.
Like neurologists or other specialists?
Yep. But the really crucial part, as you mentioned earlier, was anchoring their analysis to the date the neurologist determined the actual MS symptoms started.
Ah, so not the diagnosis date, but the symptom onset date, looking back?
Right, which was determined retrospectively by the neurologist, actually a detailed history. For most people, over 93%, it was that clinician-assigned date. That really points towards a genuinely long prodromal phase, not just, a delay in getting diagnosed.
Okay, so they've got this massive, carefully matched data set anchored to symptom onset. What was the first big thing they noticed, the overall picture?
Well, the overall picture was just undeniable.
Yeah.
People who eventually developed MS showed this consistent, significant increase in all types of physician visits.
Visits for anything, not just neurological stuff.
Exactly, all-cause visits. And this increase started showing up as early as 14 years before their MS symptoms were clinically recognized.
14 years.
14 years. And it peaked right in the year just before that recognized onset. It suggests this sort of subtle but sustained higher level of interaction with the healthcare system.
That timeline is just staggering, 14, 15 years out. What were those very early signals? What were people going to the doctor for so far in advance?
This is one of the most striking findings, a really significant increase in mental health-related visits.
Mental health. That early?
Yeah, including psychiatric visits, starting as early as 14 years before MS symptoms. They saw something like a 76% increase in general mental health visits way back then.
76%.
And even more dramatic, a 159% increase in visits to psychiatrists starting up to 12 years before onset. And it wasn't just a blip, it was consistently higher.
That's huge. The news article we looked at flagged that too, didn't it? Anxiety, depression.
Exactly. And this is really paradigm shifting. Because for so long, mental health issues in MS were often seen as a reaction to the diagnosis, right? The stress of it all.
Understandably so.
But this suggests maybe these are actually among the first physical manifestations of the disease process itself.
So not a reaction, but an early symptom. How could that work?
Well, the thinking is it could be linked to very early immune system changes, maybe low-grade inflammation, or subtle issues with the blood-brain barrier, even before there's obvious damage to the central nervous system. These could be triggering mood or anxiety issues.
Wow. Okay, so that really reframes how we might think about the connection between mental health and, well, autoimmune processes.
It does. It suggests these things might be intertwined much earlier and more deeply than we thought.
So besides mental health, what else was popping up in those very early years, 10 to 15 years out?
Alongside the mental health visits, they also saw a consistent elevation in visits for what they termed ill-defined symptoms and signs.
Ill-defined. So vague stuff, hard to pin down.
Exactly. Feeling generally unwell, fatigue, maybe odd pains, things that don't point clearly to one specific cause. Those were higher for 15 years prior.
And I guess that means more visits to their regular doctor.
You got it. Visits to general practitioners were significantly higher for the entire 15-year period leading up to onset. Just more frequent check-ins for these non-specific kinds of complaints.
Okay, so very early on, we see mental health flags and these vague, ill-defined symptoms leading to more GP visits. What about as time got a bit closer, say in that middle range, maybe 4 to 9 years before onset?
Yeah, so after those initial signals, other categories started appearing more often. Things related to sensory organs like blurry vision, maybe eye pain. Those started showing up as elevated around 8 years out.
Okay, vision issues. That sounds a bit more traditionally linked to MS, maybe?
Getting closer, yeah. And then musculoskeletal issues, think joint pain, back pain, even things like osteoarthrosis diagnosed.
Yeah.
Those started becoming more frequent about 5 years before onset.
Interesting. Joint pain, too.
Mm-hmm. And then, as you might expect, visits specifically for nervous system issues became significantly higher around 4 years before the recognized onset date.
So the pattern starts moving from general and vague towards things that feel a bit more specific but still years out. When did specialist visits kick in, like neurologists or eye doctors?
Good question. The data showed that visits to neurologists actually became significantly higher up to 8 years before onset.
8 years, so people were seeing neurologists, but maybe not getting an MS diagnosis yet.
Seems likely, yes. And ophthalmology visits eye doctors, those were elevated from 9 years prior. So you see this progression towards specialized care, but still well before the pieces were fully put together for an MS diagnosis.
And then right up close to the onset, the final 1 to 3 years, what changed then?
In those last few years, things seemed to escalate. They saw increases in visit to emergency rooms, for radiology like MRIs presumably, and even neurosurgery consults.
Neurosurgery? Really?
Yeah, suggesting maybe more acute or really puzzling problems were cropping up that required ruling out other serious conditions.
And specific neurological complaints became more common then too?
Definitely. Things like migraines, dizziness, vertigo, problems sleeping, those visual disturbances we mentioned, they were all notably more common in those few years right before the official symptom onset. The classic signs were starting to cluster.
Okay, this paints such a different picture of the timeline. So let's talk implications. The biggest takeaway seems to be
just how long this prodromal period really is. Much longer than we thought, maybe 14, 15 years. It challenges that whole idea of MS just suddenly appearing. It suggests a really long, slow burn before it becomes clinically obvious.
A slow burn hiding in plain sight in medical records, perhaps.
Kind of, yeah. And that leads back to the mental health finding again. Its early appearance isn't just, interesting. It really underscores how interconnected our body systems are.
Right. You mentioned it echoes patterns in other diseases.
Exactly. We see similar things in, say, Parkinson's or lupus, where neuropsychiatric symptoms can show up years before the more defining physical ones. It tells us that maybe a mood disorder isn't just a mood disorder in some cases. It could be an early warning sign of something broader, something systemic.
So if these patterns exist, even subtly in healthcare data, what's the opportunity here? Could we actually use this?
That's the hope, isn't it? It potentially opens doors for identifying people at higher risk much earlier. It's not about jumping to conclusions or overdiagnosing.
Which is always a concern.
Absolutely. But it's about understanding the disease pathway better so it can potentially create ways to recognize it sooner, maybe intervene earlier when treatments might be more effective. Imagine being able to act years before significant damage occurs.
That would be huge. Now, the study sounds incredibly thorough, but you always have to consider limitations, right? What are the caveats here?
Oh, definitely. And the researchers are upfront about it. A key thing is the data source. Administrative health records.
So billing codes, visit types.
Right. It tracks that stuff really well, but it doesn't capture the nuances of the patient's experience or symptoms they didn't go to the doctor for.
Yeah.
It only reflects issues serious enough to prompt a visit.
So really subtle stuff might be missed.
Could be, yeah. We're only seeing the tip of the iceberg that actually broke the surface and led to a doctor's appointment.
And what about nailing down that symptom onset date? Looking back years later, could there be errors? Recall bias?
That's always a possibility with retrospective data. People's memories fade, or current diagnosis might color how they remember early symptoms. But as we noted, for over 93% of cases, it was a clinician-assigned date based on a full history review.
Okay.
Which strengthens the argument that it's not just people remembering wrong or doctors diagnosing late, but likely a genuine, very long prodromal phase.
So given how tricky this seems, connecting vague symptoms years apart, what do neurologists on the ground think about this? Does it resonate with their experience?
Yeah, the experts quoted in the health news piece, like Dr. Clifford Siegel and Dr. Ahmed Sakdev, basically confirmed how hard it is.
They see it in hindsight, maybe.
Exactly. They often say, yes, looking back, that fatigue 5 years ago, that bout of dizziness. But in the moment, connecting those dots before an MS diagnosis, very challenging. These symptoms are just so common.
Yeah, fatigue, pain, mood changes. Could be so many things.
And Dr. Sakdev made a great point about MS itself being tricky. It's autoimmune, causes inflammation all over.
Leading to a huge range of possible symptoms.
Right. He called it general dysfunction. You just feel off, things aren't working right, but it doesn't point neatly to one single cause early on. It makes it very difficult to diagnose quickly.
Okay, so wrapping this all up, what's the message for you, the listener? This doesn't mean every time you feel tired or anxious, it's MS, obviously.
Not at all. And the experts caution against that kind of worry. But it is a powerful reminder that health is personal, as the article put it. Your body might be giving you subtle signals.
So the advice is, don't ignore persistent, unexplained symptoms.
Pretty much. Don't just brush them off if they keep bothering you. Dr. Sakdev's advice was to start with a doctor you trust, someone you connect with.
And maybe start small?
Yeah, even with just a single observation or concern that is bothersome. But if you have several things going on that you can't explain, and they stick around, pushing for a specialist referral makes sense, you really have to advocate for yourself.
It feels like this research represents a real shift, doesn't it? Moving away from just reacting to acute symptoms.
Towards potentially looking for these much earlier, subtle signals hidden in our health journey.
It raises a big question, I think. How can knowing this empower you to listen more closely to your body, to advocate harder for answers?
It's a profound thought. And while this study focused on MS, the implications feel broader. This idea of long prodromal phases of early, maybe non-specific signs, it could apply to many complex conditions.
Opening up possibilities for earlier detection, earlier help across the board, potentially.
That's the hope. It's an exciting, if complex, new frontier in understanding chronic illness.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.